that's good. It's called 10 Talks, isn't it? We know we're ripping off TED Talks. We're not bothered. We're unashamed like Aldi. But to get to 10, that's brilliant. So well done, everybody, if you've been on before. If you was with us for our last session, we was with Jo Clancy, and she was talking about delegation and the importance of taking the right approach to help grow your workforce. If you've missed it or any of those before, you can catch up on our website. And if you will definitely want to get people to watch this one, because we've just had a little mini 10 Talks before we've come on with John, and me and Kerry felt like we've learned so much already, then you can always get them to watch this and send them the link. So I'm Carla Romaitis. I'm from the Cheshire and Merseyside Training Hub. I'm the workforce lead and director of Joy. And the Training Hub, we are all about attracting, growing and retaining the workforce across one of the largest ICBs in England. Not easy to do. But I'm really excited today to introduce John. He is the most genuine person. Not only is he a health coach team lead at Brownlow PCN Liverpool, huge PCN, isn't it, John? But John is going to be talking to us with his 12 years experience in primary care and community health around the services that empower people to really make sustainable, real lifestyle changes. Today, John's going to share how effective health and wellbeing can really improve patient outcomes and support PCNs in achieving those goals. I know his key message is to employ health coaches. So, John, shall we get started?
Sure, Carla. Thank you. Thank you very much. And thanks for the opportunity to speak today.
No, absolutely my pleasure. So tell me, what inspired you to get into the world of health coaching?
So, a bit of background about myself. I was working in retail for in early to mid 20s, and I realised if I don't do something with myself, I'm going to be stuck in retail, and it's not what I wanted to do. So I enjoyed exercising, so I applied and started doing fitness instruction, and then went on to be personal training qualifications and nutrition. And learning about nutrition was a bit mind-blowing to me, because it was just like how much of an impact it does have on your health. And to me, I remember discussing, like, general public don't seem to know this. Like, we know what is healthy, but when you don't know the mechanics of it, you don't know what it is. Like, you get told whole wheat pasta, brown rice and stuff is all better for you, but we never get told why, in my experience. And learning about that, I was thinking, more people should know about this. So from that, I was lucky enough to come across jobs for the health trainers when they were employed by public health and PCTs. Showing my age, going back with PCTs.
I remember PCTs as well, yeah.
So I was working as a health trainer, and that was within primary care and community. So I was health trainer for 5 years, and it was while I was a health trainer that I learned that also you've got to take into consideration social economic factors that have an impact on health and well-being with people. So, you can focus on changing lifestyle, which is absolutely possible, but if you've got those social economic factors that are barriers there, it's getting those addressed first. So that was kind of a bit of the work that I done as a health trainer as well, which fortunately led me to becoming a social prescriber. So then I joined our PCN as the original social prescriber, set that service up, and was working on that for a number of years. And then when the opportunity comes to have health and wellbeing coaches and develop it, and from my background and the way I've done, I was just, our director approached me and said, we know your history, we know your background. Would you be interested in doing this? And I was all day long, I was just like, yeah, we can set it up, and I know how we can help. And now I've overseen a team of 8 health and wellbeing coaches, 3 clinical exercise physiologists, but our PCN have split, and now at Brownlow I'm just overseeing a team of 4 health and wellbeing coaches, and I've been lead since the creation of the services.
Amazing. So how did you discover the roles that coaches can play as, like, that we've talked about the title of being an ally in someone's health journey? How did you discover that?
So it's looking how we can complement and support. See, it's bridging the gap between knowing and actually doing. So we can support patients in making those lifestyle changes to help with metabolic health. So if you look at a lot of the health lifestyle diseases, type 2 diabetes, hypertension, cholesterol, and the impact that has on an individual's health, but also the impact it has on NHS, if we can focus on working on that and supporting people, we can do that. But also, because health and wellbeing coaches, we are kind of like adaptable and changeable in our approach and the work that we do. We can complement and support the work that clinicians are doing, especially nurses and long-term condition management. My team, we've supported our PCN with co-offering GP spec with the practices in the last year, especially around hypertension, and we've helped and support our practices to achieve KPIs, working and supporting patients, doing those changes, doing those checks. But to me, health and wellbeing coaching, it's supporting people to change, but it's not about telling people what to do. It's meeting people where they're at. It's supporting people on what matters to them. It's taking that biopsychosocial model of health and the holistic approach, where the typical medical model is like assessment, diagnosis, intervention, and then monitor and evaluate. With coaching, it's engagement, focus, vocation, and planning, and that can complement the work that clinicians do in regard to improving people's health and well-being.
Tell us a little bit about the work that you've been doing and the team have been doing then there over in Brownlow.
What would you like me to start with? Would you like me to do stuff about like the group work, the individual work, or
let's do group and then individual.
Okay, so we've been doing a number of group work sessions. We've been targeting certain lifestyle conditions. So we were working on pre-diabetes and IGR, working with one pilot where we've been inviting patients in. We've done a pilot project where we were going to do a course, because what we were finding that a lot of our patients at one of our practices weren't engaging with the National Diabetes Prevention Programme. So we wanted to try and give that support. So we came up with a course. It was a 4-week course, and we touched on different elements. And we had a focus group, and then patients originally said, yeah, no, like a little course would be great, a little course once a week, 4-week course. And at the end of it, they were like, being a bit too long. Can we just have this as one session? So we refined it, and we done this 1-hour session where it was just educating people on like what diabetes is, the risks of it, what you can do with lifestyle to help, and then giving the patients the information and then asking them what changes they feel they can make. And then we do follow-ups with these patients. And we were working with our Dingle Park practice at the time. This was last year. And from January to September of last year, we had about 60 patients attend. 93% of those patients reduced their HbA1c, with 75% of them normalising their HbA1c just from that 1-hour session that they attended.
That's an unbelievable result, isn't it? You know, to think that that's just one session. Imagine if they hadn't thought the 4 weeks was too long, what they'd be able to do with that. And so tell us about your individuals then, your individual sessions and successes from that, John.
So the individual sessions, again, like you say, what we do is we spend an hour with patients for the first initial appointment, and we focus on, again, what matters to them. We don't have a strict plan. It's all tailored and bespoke to the individual's needs. We work with patients for initial 12 weeks. We do half-hour reviews in those 12 weeks, ideally every fortnightly. And then after the 12-week intervention, we do follow-ups every 3 months for the rest of the year, just to make sure that people are on track. From that, it's looking at patients' current lifestyle, the habits, and then where they feel they can make changes. Again, it's not about telling people what to do. It's meeting people where they are at, what's the situation, and then looking at sustainable lifestyle changes that they can focus on. So a couple of, I'll share the ones that we were speaking about previously.
Yeah, please.
So we had one chap who was, he was 40 years old. He was IGR, and he got referred to me, worked on the docks, and his diet and lifestyle wasn't the best. Him and his partner were also trying to conceive. They hadn't gone down through fertility treatment at that. They hadn't been gone through any fertility or being referred. So I was just focusing on his lifestyle, just to get his HbA1c reduced, make some changes, got him change his diet. He could cycle to work because it wasn't that far, so he was cycling to work, increased his exercise. He lost over a stone, his HbA1c reduced way down. I think it was like the mid-30s, if I recall correctly. But not only that, because he made such positive lifestyle changes, him and his wife conceived. And again, he said, I didn't think I'd be a dad for the first time at the age of 40.
That's a huge impact, not just on him, but on his family, on his future. You know, amazing in terms of like being able to be referred and totally, you know, upend somebody's life for the best. But John, guess what? It's been 10 minutes, so I can't even believe it's there. But what we do now is we stop recording because we've got people on the call, and I really would want to welcome everybody to, you know, ask questions and get involved because, you know, John's give up his time.